So I'm going to go a little off topic here. This is a question I get a lot from my patients, and I get a lot from some of the podcasts we do. And I want to kind of address it because people always ask, how do you address patients in the office? I'd say that the simplest thing, especially for young surgeons starting off, is the key is if you understand what's going on with the patient, you need to be completely forthright. So, beating around the bush and saying, I think it might this, I think it might be this, and trying to make it easy for them because you don't really want to give them the full diagnosis, it's not appropriate. So my key step is I deliver as much information as I can to the patient in the office visit. I tell my patients that if you're getting surgery with me and you don't understand the surgery that you're getting, I failed to do my job. So my patients tend to leave obviously with a lot of information, especially if it's their first visit, but they are very informed. And patients do much better when they're informed. And that's why we have website listings, videos, blog topics, because information is key. And a patient that's involved, a patient that understands what they're doing, it's a trust thing. They trust you because you're telling them the truth. You're telling them exactly what they're getting. And it's unfortunately too common as a second opinion or third opinion surgeon to hear that one of the number one reasons they sought that other opinion was because they didn't feel like they were getting the truth. And so tell them what you think. You might not always be right. Again, we all do our best, but it's really important to inform your patient, whether it's surgical or non-surgical, give them all the information and really knowledge drop. Tell them everything that you know. Tell them what you expect out of their surgery. Make sure you set appropriate expectations, but also timeline, and really embrace what you do and teach others. Because every moment you see a patient that's injured, it's your opportunity to teach them something and help them get better, but also mentally and physically with the recovery. And those combination of things can be very meaningful and very effective and produce better results in your surgical patients.